I am Raj Patel. I am a gynecologist at Northwestern Medicine. I lead the comprehensive program for vulvar and vaginal health as a part of Northwestern Medicine Center for Sexual Medicine and Menopause. Patients come and see me for rare vulvar and vaginal disorders that are not commonly diagnosed. For example, lichen sclerosis, lichen planus, psoriasis of the vulva, squamous intraepithelial lesions, also hidradenitis suppurativa, Langerhans cell histiocytosis, and sebaceous hyperplasia, to name a few. One diagnosis I often see is recurrent vaginitis. Many times it is recurrent vaginitis. However, there are times when it's not really a pathogen, but rather something else mimicking vaginitis. The problem with the standard vaginitis panel is it tests for three basic things. It tests for yeast, it tests for bacterial vaginosis, and then trichomoniasis. However, there are many other things that can result in symptoms of vaginitis. For example, cytolytic vaginosis, or desquamative inflammatory vaginitis, or ureaplasma and mycoplasma. Sometimes in patients who are diagnosed with vaginitis and do have positive testing for a pathogen, that pathogen may just be an innocent bystander. They may have an underlying dermatoses or neuropathic pain or itching that's left over from a prior vaginitis. The problem with vulvar and vaginal problems is many patients don't talk about it, and it's not as part of a routine exam to ask the patient about these areas. So the best way that OBGYNs, the generalists in the community, can help is by asking open-ended questions about if they have any concerns about their vulva or vagina. Since these vulvar and vaginal disorders are so rare, it's possible that a clinician may have never encountered them in their training or career. At our center at Northwestern Medicine, we take a multidisciplinary approach to treating the patient. We have access to physical therapists that work with only our patients. We have access to sex therapists, and furthermore, we work with pelvic medicine specialists and interventional radiologists. Unique treatments we offer at Northwestern Medicine that may not be accessible easily for patients elsewhere are things such as intralesional injections, laser surgery, and rarer surgeries such as vestibulectomy. At our center, teaching is a priority. I especially enjoy being at an academic center like Northwestern Medicine, so I can share the information about vulvar and vaginal health with other providers and clinicians. I think it is very important to expand the curriculum for medical students and OBGYN residents to include vulvar, vaginal health, menopause, and sexual medicine.